there's a lot of information out about primary prevention. There's some really wonderful resources that we can refer you to through the Center for Disease Control, which funds both Rebecca and my programs, on ways to do primary prevention, as well as resources that are working in communities around the state and the country. One of the things that we're trying to do with primary prevention is not just one person at a time. A lot of traditional prevention efforts are to go to individuals and teach them what to do to either keep from being victimized or keep from being a perpetrator. And that's one level of primary prevention. But other levels include doing things like community level change, social norm change, policy change, legislative change, to create a community in which the violence is not supported and the potential for not perpetrating is supported over and over again in all the layers around the individuals. And it's called the social economic ecological model of prevention, which is that you have these different layers that affect a person. And the more we can affect all of those layers, the more likely the individual will be to change. Some examples of some things that are happening right now that are primary prevention include legislation, some that's passed and some that's been introduced right now to do more about healthy relationship building for teens in communities around Ohio. We have just this past year started clubs in schools for boys where men facilitators are working with young boys to talk about what can these young men do to make their communities safer, make their schools safer, and what's their personal involvement and responsibility in doing that. And then curriculums for both boys and girls that promote healthy sexuality and relationships. So there is a fair amount of that going on already, and we'll be talking a little bit about our plan about how we're trying to expand that even more around Ohio.
Yeah. One of the ways that when we're doing training for ODN, well, so the Ohio Domestic Violence Network is the network of shelter programs around the state. Just about every domestic violence program in Ohio is a member of our organization. Sort of, if you were here earlier and heard Greg Cathcart, he's with Prevent Child Abuse Ohio. They have all the child protective services as their members. We have all the shelters as our members. It's a kind of similar model. But when we do training, we talk about primary, secondary, tertiary prevention, and then it's kind of hard, to change all this language that we've been so accustomed to using. In the field of domestic violence, for example, for years we've talked about prevention, but really what we've been talking about is preventing the second or third or fourth perpetration of that crime or the victimization of, and so we're starting to think in terms of prevention is primary prevention, and when you're trying to keep the violence from happening in the first place, then you're preventing the occurrence of the victimization or perpetration, and then everything else after that is intervention. So, and if you go to Japan, they have a different language for all of it, which makes it even more clear, but I'm not Japanese, so that doesn't help people. Chrystal?
I just had a quick question.
Sure.
How do you know that primary prevention is working?
Oh, yeah. Well, and isn't that interesting? Because you don't, right? How do you measure what doesn't happen?
Right.
And so I don't know. We set up. It is a challenge. So you set up different kind of outcomes for that. Ultimately, we want to see a reduction of intimate partner violence and sexual violence across the state, right? But since that's not going to happen for maybe 30 years, if we're really lucky and we do really good work, we have to look for other indicators. So what are those indicators that would help, that would have us think that maybe we're on the right track? I don't know. What do you think, Debra?
But it was also almost in like a catch-22 with what Rebecca said about wanting to reduce the level of sexual and intimate partner violence, because we know that the more we talk about this right now, the more reporting goes up, because there's so many people that aren't reporting right now. So that goes back to that very first step of defining the problem, and how we know that probably somewhere only like 1 in 10 sexual assaults are ever reported to anyone. So seeing a decrease in sexual assaults is actually not really a good thing, because it means that people are not reporting and so it's a real conundrum. So what we try to look at instead are things like knowledge change, behavior change, which are also really hard to measure. It's really expensive to really track over any kind of time. So we aren't doing a lot of good, and increasing our evaluation. That's part of the developing and testing your prevention strategies to do good evaluation, and I think we're really still in the beginning stages of learning how to do that well.
And we're in the beginning of stages of understanding what those community indicators are. And in schools, if you're looking at a school community, you might consider that an indicator would be decreases in sexual harassment in schools, the sexual, what do they call it, sexual bullying. That kind of behavior might go down. You might see fewer incidences of inappropriate touching if you have healthy relationships, curriculums going on in the school. Those kinds of things might begin to indicate. But then how do you translate that out to the broader community? Certainly, maybe you would see less of that, but there's no way to necessarily capture that. That's a great question. I don't know. When you figure that out, let me know. Because that would be really helpful for us all. And you got to know that we started at ODDN with prevention, really thinking about prevention in 2003, and with the domestic violence prevention enhancements and leadership through alliances funding, Delta funding that's coming through the Centers for Disease Control. So that's all we know at the state level about prevention is everything we've known, or everything we've learned in the last 6 years, which that's not very long. How about for you at ODH? It's about the same.
Yeah, I mean, actually, I think Delta was a little bit ahead of us in terms of really transferring to the primary prevention model of what we kind of begun hearing about and talking about it, but
and it's crazy if you think that we're trying to do all this work with 6 years of knowledge, but we got to start somewhere, right? I mean, years ago we started tobacco cessation work. And look where we are today. Now we have, imagine, Debra, now we have a law. They're going to make tobacco regulated. I'm not sure what the law would be for us, but maybe someday there'll be some real institutional change that we'll be able to look at and say, wow, who were the mothers of that? So as we began working on this, one of the things that we recognize is really important is evaluation. And the CDC, the Centers for Disease Control, back in 2005, began to push us toward this new model of evaluation. Has anyone heard of empowerment evaluation in here? So you have, and most folks haven't, right? Empowerment evaluation is a relatively new concept in evaluation, and the CDC asked all of those states that were involved with the Delta program to adopt that as their model. And this model is both practice and principles. So the practice of empowerment evaluation means that you hire a consultant who coaches you, basically, to evaluate your programs, and it's very big on capacity building. So they're teaching us at the state level and in local communities that are implementing the Delta program in Ohio how to evaluate their programs. So we're doing a lot of self-evaluation. I swear I have learned more about evaluation in the last 6 years than I ever thought I'd know. I'm sometimes the things that come out of my mouth are just like, I can't believe I just said that, as they relate to research and data and that kind of stuff. So that's the practice side. But at the principle side, these are all the principles of empowerment evaluation, and you have a more articulated version in your handout packet. The guidelines, we set up our work as, with the state consortium that we're going to talk about a little bit later, to use these